Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County, Oregon. So this is part 2 of our Doppelganger analysis. So you remember last week we looked at this beautiful map and looked at the counties of Douglas County, Oregon, Twin Falls County, Idaho, Pennington County in South Dakota that has Rapid City in it, and Lowndes County in Georgia that has Valdosta in it. And we saw that in Douglas County we had far fewer deaths and more unemployment. These other areas had varying levels of unemployment and deaths. So we got a lot of great comments and a lot of views, and so this is my chance to answer some of those questions. Now, one of the questions was that the counties didn't seem to be identical, and that's why I didn't call it the identical twin analysis and called it rather the doppelganger analysis. Doppelgangers are things that are similar but not exactly the same. But I looked into these to see. Now, some people suggested that maybe the age distribution, the race distribution, the population density, or other factors accounted for the differences, and we'll go through those tonight. I don't think they do. So to check out the varying demographics in the counties, we used 3 sets of data. One is from the U.S. Census, Quick Facts, that allows us to compare the 4 counties. The Robert Wood Johnson Foundation has a thing called County Health Rankings where you can compare the counties. And Maptitude has a measure of annual average daily traffic on the different areas. So one commenter suggested that Valdosta may have done worse because they had a lot more traffic. Well, this map, which is a great map on Maptitude, you can see on the density of the line how much traffic there is. Actually, it turns out that all of the areas have lots of interstate traffic, but Douglas County, with I-5 going right through it, has the most traffic, Valdosta the next, but both Twin Falls and Pennington have lots of traffic. So I don't think the difference in traffic can explain the difference. Some people suggested that the age and sex distribution and the racial distribution might make a difference, and I think there is clearly some issue there. So when we look by age, Douglas County has far and away the oldest group of people, with about 26% of the population over age 65, but in Lowndes County, only 12%. We know that age is the most potent factor for predicting a bad outcome. So in this case, Douglas County actually should have performed worse. In racial makeup, Lowndes County had the most people of color, Twin Falls County had the most Hispanics, and Pennington County had the most Native Americans. So there was no one county that had all of the risk factors against it. In terms of pre-existing health, all of the counties had pretty nasty pre-existing health. They all had high levels of smoker. Again, Lowndes County had the most smokers, the most physical activity, and the most adult obesity. Although Douglas County had the lowest rate of flu vaccinations and the lowest rate of high school graduation. This is terrible. We should improve everybody's health. But again, I don't think the background level of these factors could explain these differences. One person suggested that it might be the number of migrant workers. And there is a website that looks at the number of migrant workers in each of the areas. Douglas County had over 900. None of the other areas had over 500. So again, in that measure, Douglas County might have performed worse, but indeed we saw it had the lowest death rate. Now, somebody suggested I cherry-pick the counties or cherry-pick the states. I really didn't. In fact, I did whatever I could do to avoid cherry-picking. So, for example, in South Dakota, both Aberdeen and Sioux Falls both had large workplace outbreaks. I didn't want to consider that. In Georgia, Albany, Georgia had a big outbreak associated with a wedding. I didn't want to include that. And then somebody suggested I should compare all of the counties, and that's what I did. So there are about 2,500 counties in the United States, and of those 2,500 counties, I picked those counties that had between 100,000 and 125,000 population. Picked all of them, used all of them, and looked at the rates of death in all of those areas. And you can see that 2 of the counties, one in New Mexico and one in Arizona, that have a big Navajo population, had a tremendous amount of deaths. And then I looked at all of the other counties. So remember, Rapid City had 33, Valdosta had 63, and Douglas County had 2 deaths. And then I looked in all these different areas. Somebody asked that I pick a doppelganger county in a highly restrictive area. So the most highly restrictive areas were New York and Massachusetts. So one of the closest counties is Tompkins County in New York. It's where Ithaca is, and Ithaca College and Cornell. They've had 0 cases. Other counties, similar sized counties in New York, have had 3, 1, and 4 counties. So in New York, where they were restrictive, they've had very few deaths. In Maine, there's Kennebec County, which could be a comparator. It's not really on a freeway. It doesn't have much agriculture, and they've had 10 deaths. Androscoggin County had 11 deaths. So again, in these restrictive areas, they had relatively low numbers of deaths. Now you'll see one outlier here. You'll see Berkshire County. So Berkshire County had about 35 deaths in the first few weeks. And thus it would be a little hard to know how restrictions would work because all of those deaths came so early. I will tell you, since April, they've only had 10 deaths. So again, I would say that in these areas where there was a lot of restriction, they had a relatively low number of deaths. The other area that were highly restrictive were Washington, Oregon, and California. It turns out there's not a single county in California between 100 and 125,000, and only 1 in Washington and 2 in Oregon. So Yamhill County had 14, Cowlitz County had 6. So again, in these more restrictive areas, we see that the rates are pretty low, and the median number in the highly restricted areas was about 10. When we look at the less restrictive areas, which is generally those areas south of Virginia, Texas, South Dakota, Idaho, and Utah, again, not a lot of the different counties, but you'll see in Georgia and Alabama and Mississippi, a lot of deaths. 96 in Louisiana, lots of deaths here. One county in Florida with a low number of deaths, but in general, lots more deaths in the areas that had less restrictions. And then I looked at the unemployment. Again, the unemployment was slightly higher in the areas that had more restrictions. So it ranged from 7.5% to almost 16% in New York. In these other areas, it ranged from about 7.6 to 12%. So I think the initial analysis using all of the counties holds. Then the areas that had more restrictions, they had fewer deaths and may have had more unemployment. So I think it holds. Now, if you wanted to figure all of these things out exactly, you would need to do what's called a multivariate analysis. And a multivariate analysis looks at all the variables and controls for all the variables. Very complicated to do, and your eyes will gloss over in a moment. So we didn't do that. The other thing that people asked is they asked us to include the indirect costs. So we included the direct costs of hospitalization and the direct costs of the job loss. People asked about the indirect costs, like the cost of having a complication, a medical complication from COVID that you might need to live with, especially kidney failure. And then other people asked us to include the indirect costs of economics. So if a business closes, what happens there? Or if you lose your house, what happens there? That is a very complicated analysis, far beyond what I can do, but I really hope there's some economist or some social scientist that will do it. And I'll end with the concerns that a number of you mentioned about suicide. Suicide is an incredible concern during the COVID pandemic. Recently released studies suggest that more and more people are depressed, more people are anxious, and more people have had suicidal ideation. I tried to find data looking at the variations in suicide rates around the country related to the pandemic, and if it's there, I can't find it. There is some anecdotal data that in places where there's been a lot of disease, that there are some suicides related to the disease. I tried to find data, and I couldn't find it. I did ask, in our county, I did ask our medical death investigator, and he says both the rate of suicide and drug overdose death is considerably down this year. So that's good news. But again, I don't think we can lose sight of the fact that this has been a terrible pandemic for everywhere in the country, whether you have high restrictions or low restrictions. And that what we try to find is the balance. What is the right balance of restrictions, and what is the right balance of economic devastation that we try to find? And I'm not saying that any place got it right or got it wrong. I'm just saying there is a clear correlation. Again, this is Dr. Bob Dannenhoffer, Public Health Officer of Douglas County. Thanks.